So my name is Yolanda Hugh. I'm with Tapestry Senior Living. We are very excited to host this seminar regarding the assisted living Medicaid funding that's available. We've brought together Twyla Sketchley, Candace Rudd, and Marissa Henderson to answer some of those questions and really help give you guys a understanding of how the process works and really what the waiver is. And so we're really excited to be here. Just some kind of housekeeping. We encourage everyone, if they would chat their questions into the chat box. The speakers will present, and at the end of their presentation, Mackenzie and I will go through the chat box and ask those questions. But we are really excited, and also for if anyone has to hop off or, maybe some technical issues, we are recording this so that we can share it post-event. So if you do miss something, no worries. We'll send out the replay here in the next day or two. So again, we're really excited to have everyone, and I will go ahead and we'll get started.
Hi, I'm Mackenzie Beal. I wanted to introduce Twyla Sketchley, a Florida Bar Board Certified Elder Attorney in town. She's actually been practicing in Tallahassee since 2002. Twyla runs a great blog as well, so you can get a lot of information from her blog. I know I receive the blog in my email. And Twyla likes to garden on her free time, visit national parks with her husband, and spend time with her family. She's also great at sewing. I know she was making masks for a while as well. Super involved in the community, and we're very lucky to have her on our call.
Okay, there I am. I was trying to unmute myself. Well, I'm kicking this off with some kind of basic information. I am going to be talking about Medicaid eligibility as it applies to an assisted living facility, which is different than Medicaid eligibility in a nursing home. Under Florida law, if you are eligible for Medicaid institutional type care or long-term care, as we call it, there are two programs. There is the institutionalized program where you're in a nursing home, and then there's the home and community-based services. And those home and community-based services include assisted living. The eligibility requirements are the same. And my friend Candace is going to talk about the eligibility requirements later on and some specific things you need to do to be eligible. But for now, in the chat, I have posted a link to a blog, and I update it every year. So this is the 2020 numbers. In the next month, there'll be a blog that has the 2021 numbers. But this is some basic numbers about Social Security, Medicare, and Medicaid. And we're actually going to focus on the Medicaid eligibility, and I'm going to try to share my screen, but I don't know that I can. Here we go. Oh. Okay, I can't figure out how, hold on here, let's see. Here I am, let's see. Can everybody see that? Okay, so this is the basic Medicaid eligibility for someone who is in the Medicaid long-term care program. I'm going to talk about an individual. If you're married, there are some available things for you to have more assets, but we're just going to talk about an individual right now. So your monthly gross income has to be less than $2,350 a month. You have to have less than $2,000 in countable assets, and you need to have intermediate or need for intermediate or skilled care. Now, when you're planning for your long-term care in an assisted living facility, you need to think about what's going to happen when you run out of money. So if you're in an assisted living facility, or your loved one is, and that loved one is starting to get low on funds and in order to continue to pay, and you suddenly decide we need Medicaid next month to pay for care, That may not happen. And that may not happen for a couple of reasons. First of all, it may not happen because there is a wait list for home and community-based services in Florida. And my friend Marissa is on here, and she's going to discuss the wait list and how to get on the wait list and how to get off the wait list. The other reason is that you've got to be in a facility that accepts Medicaid. If your assisted living facility is not part of a Medicaid managed care program and accepting Medicaid, it doesn't matter if you are eligible for Medicaid or you get off the wait list, you're just not going to get Medicaid to pay for that assisted living facility. So the first two things you have to deal with is being in the correct facility, an assisted living facility. So Tapestry at Lakeshore is one of those facilities. The second thing is the wait list. And I'm going to let Marissa explain how to get on the wait list and off the wait list and how that is screened. Another big issue that needs to be addressed when you're planning, because you have to start planning for Medicaid in an assisted living facility before you run out of money. I tell families if they're looking at wanting Medicaid in an assisted living facility that from the very beginning of placement, we are looking for Medicaid eligibility. That way we are planning to be eligible when that person is out of money. They've spent down their money appropriately, or they've started a pooled trust or something like that, so that they can pay for their care in the assisted living facility that accepts Medicaid and they're off the wait list. Now, there's a couple of things that families need to plan for. First, you have to know what Medicaid pays for and what Medicaid does not pay for. Medicaid in home and community-based services is different than in the nursing home services. For nursing home services, if you're in the nursing home and you're on Medicaid, Medicaid is going to pay the entire bill except for your patient responsibility. And your patient responsibility is a formula, and it's basically all of your income minus a personal needs allowance and some insurance if you're an individual who isn't married. That is not what happens in an assisted living facility. And everyone is used to talking about Medicaid eligibility in terms of the nursing home. If you're in an assisted living facility, federal law prohibits payment of Medicaid dollars for room and board. So if the room and board is $2,900 a month for the assisted living facility that you are in and on Medicaid, Medicaid will not pay that room and board. They will only pay what we call your level of care, and that's approximately $1,250. So the assisted living facility, if you're eligible for Medicaid and you're in the assisted living facility that accepts Medicaid, is going to get $1,250 from the Medicaid managed care organization. You or your loved one, the loved one who's in the facility, or family members are going to have to figure out how to pay the room and board. So if it's $2,900 and your loved one has $1,800 a month in Social Security and no other source of income, they're going to have to come up with $1,100 a month to pay for the room and board. And if you only have $2,000 in countable assets, you don't even have the ability to pay for 2 months to be on Medicaid in an assisted living facility. So how is that going to be paid? Well, that's going to be part of the planning process. Are you going to establish a pooled trust? Are you going to prepay family members so that this money is available for you? So that's one issue that you have to plan for. And that amount differs based on your income. So if you have someone who has $3,100 a month in income and they only need $2,900 a month for their room and board, they may have $200 a month extra for income. However, the issue becomes, what if you have income that is $2,900, but your Medicare supplement is $300 a month. Well, somebody's going to have to come up with, you're either going to have to keep your Medicare supplement or somebody's going to have to pay what you don't have toward that. And if we were in my office, I would be drawing this out for you based on your loved one's situation. And we call this the family contribution, because ultimately what happens is oftentimes family members, be it a spouse or adult children, contribute to that room and board portion to make sure that mom and dad can make that payment. The other issue that comes up that is different than nursing homes is the payment of your Medicare supplemental insurance policy and your personal needs allowance. If you were in a nursing home and you had a Medicare supplemental policy, you would have that deducted from your patient responsibility. So if you had $1,800 a month and your Medicare supplement was $300, your patient responsibility would be approximately $1,500. Well, if that's the case in an assisted living facility, your room and board responsibility is going to be $2,900 no matter what. So how is that Medicare policy going to be maintained? The second is, if you are in a nursing home, you get to keep $130 a month as your personal needs allowance. In an assisted living facility under Medicaid, Medicaid is going to say you get to keep that, but if Medicaid prohibits the use of Medicaid dollars to pay for your room and board, well, that $130 is really going to your room and board. So it's not the same as you getting to keep it to buy your moon pies and cashews. All right. I have 10 minutes, right? I'm trying to keep track of my time. So when you're planning, what I would suggest that you do is, when you believe that your loved one may be in need of care in an assisted living facility here shortly, within a short period of time, I tell families to contact an elder law attorney. They need to talk to that elder law attorney about whether or not your loved one has the amount of money to pay for assisted living facility for lifetime. If not, we have to start thinking about Medicaid. And when we start looking at Medicaid eligibility, we have to start looking at whether or not we can get the loved one on the wait list, how much time it's going to take for that money to run out, and will there be resources available, either income for the loved one or some other source of resources to pay that room and board. We then put together a plan for Medicaid based on that. So we may tell our family, go ahead, be admitted to the assisted living facility. And we make sure that it's one that accepts Medicaid. And I want to caution you here, there are assisted living facilities that accept Medicaid that you can find if you go to floridahealthfinder.gov, and you can see that they accept Medicaid. There are some that are good facilities, and there are some that focus more on very low income, oftentimes patients with mental health issues. So you have to be real careful where you've put your elderly loved one with dementia, because you don't want them in a facility that's not appropriate for them. So we get mom or dad admitted to that facility. We may say they've got money to pay for 6 or 7 months of care. When we do that, we are planning that by the time they're running out of money, they're going to be getting off that wait list so that they're Medicaid eligible. We're also going to be planning so that they have enough resources available to pay their patient or pay their room and board. So, and I'm done, and I think Marissa is next. She's going to explain to us the wait list.
Thank you, Twyla. I really appreciate that. Sorry, I had to reclaim host status so I can pass the floor to Marissa. So we're very excited to have Marissa join us. I'll have to give the host status to her. One second, we have some folks joining us, so let me admit them from the waiting room. Hello, hello to those that joined. So we're really excited to have Marissa present. So Marissa has been working with seniors for over 17 years. She began as a social worker with Meals on Wheels through the Elder Care Services. She's been with Advantage Aging Solutions for 12 years, and she truly has a passion for advocating for our seniors. And so I want to thank her for joining us. And so Marissa, I am going to make you the host at this time so that you will be able to share your screen and present. Thank you for joining us.
Okay, thank you, Yolanda. So I am going to share my screen because I have a short PowerPoint for you guys. Just a moment. Okay, give me a thumbs up if you guys can see that. All right. Okay, so I am Marissa Henderson. I am the director of the Aging and Disability Resource Center here at Advantage Aging Solutions. Now, we've had that name for a short while. We are actually the area agency on aging for North Florida, doing business as Advantage Aging Solutions. And our executive director is Ms. Lisa Bretz. And so I'll just go into I'm going to go into our agency overview and then the wait list process, like Twyla said, for you all. So Advantage Aging Solutions, we house the Elder Helpline and the Aging and Disability Resource Center. We assist seniors 60 plus and the disabled who are 18 plus with disability benefits and their caregivers. We connect them with federal, state, and local resources and programs. These programs help them remain independent in their homes or at an assisted living facility for as long as possible. So what we do is we get people on the waiting list for those programs. And we do assist people with the assisted living facility and in-home, like I said. Now we assist them with information, referrals, and the application process to begin receiving services. Those services include assisted living facility services, home delivered meals, companion services, personal care, homemaking, emergency alert response system, incontinence supplies, etc. Now, our office, there are 11 area agencies on aging in Florida. So you'll see here, we are planning this service area too, and we cover 14 counties. You'll see us up at the top in the turquoise area. So the roles in the aging network, so it all starts with the legislature. They vote us in, they voted us into, they give the funding to the Department of Elder Affairs, which is the State Department. The State Department of Elder Affairs then gives us the money, and we funnel the money down to the 14 counties in our area. And we work with lead agencies in each county that we work with, and you'll see those here. So pretty much in Bay County, we work with the Bay County Council on Aging. And like here in Leon County, it's Elder Care Services. We also partner with Legal Services of North Florida and all of the providers that you see here. Now, these are just some of the programs that we have that we sign people up and get them on the waiting list for. The one I'm going to be going over today is the statewide Medicaid Managed Care Long-Term Care Program, which is affectionately called the Medicaid Waiver Program that Twyla was just talking to you all about. So the starting point, we are actually the starting point to get on to the Medicaid Long-Term Care Program. In order to do that, you have to call our Elder Helpline and get on the waiting list. It's open to the public to call for information. Anybody can refer somebody to the Elder Helpline. This is our number, the 1-800-96-ELDER. It can be called from anywhere in the state. So what happens is, if somebody's down south and they call this number, it will go to their local area agency on aging in another planning and service area. If they're in Tallahassee or surrounding area, the 14 counties, it'll come to our office here. Now, a lot of people get us mixed up with the abuse hotline. We're not the abuse hotline. They're the 1-800-96-ABUSE. Okay, calling the Elder Helpline. So what happens is we have 3 information and referral specialists here who gather the information. So when somebody calls in, they'll take that information, gather the demographics for the person, determine the client caregiver needs, and provide the community resources if needed. Then what they do after that is they will refer it over to my department, which is the Aging and Disability Resource Center. We are under the same agency. So they just refer it over to our counselors. We have 7 counselors in under myself who do the telephone screenings. So once INR refers it over to my department, the ADRC is what we call ourselves for short. We have 3 business days to contact the person and get them placed on the waiting list for the programs and services. So what we do is the ADRC staff will conduct the telephone screening assessment with the client or the caregiver or whomever the client gives consent to. The telephone assessment will automatically populate the client onto the waiting list, and it's based on the person's frailty. This is determined by the client's answers to the telephone assessment. And the main factors are, as there are questions about the person's activities of daily living, that would be like their abilities to bathe and dress and walk and do things for themselves. And it also is determined by the person's need versus their have. And what that means is, say for instance, somebody is needing assistance with bathing and dressing, but they don't have that assistance. And then there's another person who needs help with bathing and dressing, but they have that assistance, such as like in the assisted living facility. Sometimes the person will be lower on the list because they have a need, but they already have that need met, if that makes sense. So that's the way that the person is populated on the list. The screener will put the information in the computer for the Department of Elder Affairs, and it automatically generates the person onto the list based on the way they answer the questions on the screening. So the ADRC staff will add clients to the appropriate wait list based on their eligibility. Depending on the client's needs, they can be on the wait list for multiple programs. In this instance, for the assisted living facility, it will only be the one program, which will be the Medicaid waiver, the SMMC LTC program. But if it's somebody in the community, they can be on other programs as well. Now, their frailty plus the availability of funding will determine how long they're on the waiting list. We frequently get asked, how long, am I going to be on the waiting list? The ADRC staff does not know how long an individual will be on the waiting list. Now, what happens is a client may call back at any time for a health update if they have any changes in their health, a new diagnosis, or, a caregiver status, maybe the caregiver is not with them anymore or something like that. So just keep in mind, even if you're in good health today, tomorrow you break something, have to go to the rehab, you can call back and you can update your screening. Now, the SMMC LTC Medicaid waiver program, the release process. So what happens is you're on the wait list, okay, and then once a month, the Florida Department of Elder Affairs, which is our state department, does a release of names, and they release those names to our department here. Those individuals are ranked at the top of the waiting list at that time for the program will be released. The ADRC staff contacts those persons to assist them through the application process for the Medicaid waiver program. So what we do is we assist them with every aspect of getting the application process done for that program. So the application process. The SMMC is also referred to as Medicaid waiver, or you hear it being called long-term care or Medicaid long-term care. It's all the same program. This program provides home and community-based services at home or at an ALF or at a nursing facility. So it's the same program. It will provide services for those things. People can move, people can move. Say for instance, if you're in a nursing facility and you come, if a rehab and you come out, you go to the ALF, same program will still be able to provide the services. Okay, so who is eligible? Those who are 65 plus or 18 plus with disability benefits. Your income needs to be less than $23.49 and the assets are less than $2,000. Some stipulations apply, and Twyla just talked to you all about that, and Candace will talk to you all about that later as well. Those who have been determined to require medical level of care by the Department of Elder Affairs CARES unit. Twyla spoke a little bit about that earlier. Now this is based on a person's medical information submitted by their doctor. So what happens is the doctor has to send in a form to our office, and we send that to the CARES unit, and they'll assess the person for a level of care. Now the application process begins with our agency. However, once an individual is enrolled in the program, they will receive a care manager from the managed care organization that they choose. Okay, that was it. Now I'm going to do a recap just so that I'm being clear with everyone. So the recap: anyone refers a person to the elder helpline. Then the information and referral specialist gives resources and refers the person to the ADRC unit. The ADRC staff does a telephone assessment and places the person on the waiting list. The length of time the person waits is determined by their frailty and the availability of funding. Once the person's name is released from the waiting list, the ADRC staff assists the person with applying for the Medicaid waiver program. So our staff does assist them. The ADRC staff assists with the Medicaid application and gathering the Medicaid paperwork from the doctor's office. I'm sorry, the medical paperwork from the doctor's office. The person who chooses, chooses the managed care organization once all the paperwork is complete. The person then is enrolled into the Medicaid waiver program on the first day of the following month. So if everything is completed and within 1 month, they only activate people on the first day of a month. So what happens is if all the paperwork is complete, like today, that person will go active for November 1st. Then after that, the managed care organization's care manager will contact that person to coordinate their services, whether that be the assisted living facility services or nursing facility or in-home services. And then payment for the services begins, yay. Thank you. Again, I'm Marissa Henderson, the Director of the Aging and Disability Resource Center with Advantage Aging Solutions. And we will take questions in the chat later, I believe.
Yes.
So let me see if I can get this back.
Yes.
Did you take it? You got it?
I think I did. Thank you so much,
Okay.
Marissa, for that information.
You're welcome.
And then I'll let Mackenzie take it on.
Hi, I'm Mackenzie again. I'm introducing Candace Rudd, an attorney, associate attorney with Walduck and McConaughey. She also practices in Florida. We're very lucky to have Marissa, Twyla, and Candace on today, so thank you. Candace practices in the areas of probate, guardianship, estate planning, and public benefits, planning for and responding to issues arising from aging and capacity. She graduated with a Bachelor of Social Work from Baylor University, and Diana R. Garland School of Social Work, a Master of Social Work, Clinical Concentration from Florida State University, and her Juris Doctorate with honors from Florida State University College of Law. So we're very happy to have Candace on. She works with older adults, persons with disabilities, mental health, and advocacy. Candace, take it away.
Hello, hope everybody's doing well. So I'm going to share a quick PowerPoint. Some of it's already been touched on a bit, so you'll get a little double dose, but I promise you the numbers will still seem daunting. Okay, everybody can see clear? So Medicaid eligibility as far as statewide Medicaid managed care, long-term care is concerned, that's all we're going to talk about. There are so many different Medicaid programs out there, so we're going to be very limited in our discussion. As Marissa said, you have to be 18 or older. If you're under 65, you have to meet certain disability criteria, either from the federal government or from the state. You have to have appropriate level of care, which is kind of the medical eligibility side of it. And then the financial eligibility criteria must be met. If you're going to receive home and community-based care, like assisted living assistance, then you need to also be enrolled in the waiver program. So Florida defines medical eligibility as needing nursing home level of care. So it's going to be assistance with 2 out of 5 ADLs. I listed the ADLs for everybody to see. So it's bathing, dressing, transferring, toileting, and eating. That's the ones that we consider. Generally, people need assistance with their instrumental activities of daily living, their IADLs first, and then their ADLs. So even though your loved one may need assistance in one aspect of life, unless they need these hands-on assistance, they are not nursing home level of care yet. Financial eligibility. Twyla put up that great blog post so everybody got to see those numbers. This is just kind of a condensed version, same exact numbers. So when you come in to see an elder law attorney, we're going to ask you for all kind of documentation to evaluate your gross income and your assets. If you're married, we want to see all those joint assets and individually owned assets. It's very important that everybody understand this is a gross income number, not a net. So we kind of fall into a pitfall with people sometimes on that confusion. So if you are over the income limit, then you're going to need what's called the qualified income trust. And if you're over the asset limit, you would likely need some planning. Some people choose to work with an elder law attorney to spend appropriately for planning. Others decide to private pay and just what's called spend down over time. So, you know, it's a decision that should be made early, and we always recommend you talk to somebody to learn the positive and negatives of both decisions. So qualified income trust is what they would like me to focus on. So you'll see several slides. And what that is, it's going to be a income only irrevocable trust, which sounds real fancy, but really all it is a trust that's going to hold income and pay out under certain standards. When the money flows through this trust, you become income eligible for the Medicaid benefit. So you'll see at the bottom of the screen, there's only certain qualifying expenses that can be paid from the trust each month: medical care, patient responsibility, personal needs allowance, and spousal support if that applies to you. So every month, the applicant's income is going to go into their traditional account, and then it's going to go into the qualified income account, and then it's going to be paid to the facility. So you'll see here, I put our little chart that I made for clients. So when you come to my office, we just kind of go through this step by step. It is very confusing the first 2 to 3 months that you do this, but then after a while, you kind of get into the habit. So if you're in a traditional skilled facility, you place that amount in there and you just pay it out to the skilled facility. If you're in an ALF, it could be a little different. So you might put all of your income into the qualified income trust, but you only have to pay a portion for room and board. If you have funds left over, you might be able to pay that money back to yourself. or you could use it to pay for health expenses. So it kind of plays out differently depending on your individual situation. But the most important part is that that trust is properly funded every month. If you fail to fund the trust properly, you are ineligible for Medicaid benefits. So it's something that you really need to keep an eye on. Make sure you're looking at that statement every single month. And the Department of Children and Families requires quarterly statements from that trust be provided to them. It'll also be part of your annual review when you apply for benefits. So the trust has to be properly funded every month that you seek benefits, meaning if you no longer desire Medicaid benefits, you would stop funding the trust, but the account remains open because it's irrevocable, so it cannot be revoked. It can't be terminated without certain provisions being met. Generally, the qualified income trust terminates at the death of the applicant or upon written authorization and approval from DCF. More often than not, it's the death of the applicant that terminates the quit. At that moment, the bank will freeze the account. Everything in that account is untouchable from that moment forward. You would then turn over those funds to the state of Florida in a very specific manner. You have to have a letter, copy of the death certificate, a statement from the last month of the account, and a closing check that matches that balance. And that goes to the Agency for Healthcare Administration. They're the one that's going to handle all that for you. So that's the qualified income trust piece. I did want to touch on the transfer of assets really quickly because this is something that can get you into trouble down the road. Medicaid has a 5-year look back. So DCF is going to look back 5 years from the date of application to see if there were any transfers for less than fair market value. That includes gifting and selling items for less than their worth. Sometimes we see people who have transferred their home, which is a very bad idea. We want to make sure you're talking to an attorney before you do any kind of gifting, because you don't want to get into a penalty period. And you'll see on the screen right there that there's a certain formula used to calculate how long your penalty period is. And that's the period you were not allowed to have any kind of Medicaid benefit. So this is something to look out for and just be aware of. Now, you've heard Twyla and I say multiple times, talk to an elder law attorney, talk to an elder law attorney. That's because you will see that this is a very technical area of law. There is federal statute, state statute, policy, all that goes into Medicaid planning. And if you don't follow all the rules, you get yourself into some really big trouble. So nobody wants to commit Medicare fraud or Medicaid fraud, purposely or accidentally. So if you are considering applying for a benefit, it is worth your time and money to talk to somebody and get a good picture of what your income, assets, and possible eligibility is. So one part of Medicaid planning is understanding that there is a Medicaid estate recovery system in Florida. That is why the qualified income trust balance goes to the state of Florida at death. So once you're 55, any Medicaid benefit that you receive, the Agency for Healthcare Administration is going to keep a tally of it and add it up. And when a probate estate is opened for that individual, ACA will place a lien against the probate. So it's very important to understand probate avoidance, what assets would go through probate, how would I avoid that if I needed to, why I wouldn't need to if I don't. So there's more than just planning for the Medicaid benefit now, you also have to plan for what happens at death. One element of Medicaid eligibility I wanted to touch on very quickly is the requirement to apply for all other benefits for which you are entitled. That includes VA aid and attendance benefits. So if you meet the criteria to receive aid and attendance, Medicaid is going to request that you apply for those benefits before Medicaid can be approved, or you have to attempt to apply for those benefits. This is just some real basics over aid and attendance. It's not kind of the focus of our talk today, but I just want to put that in your mind that is part of the application process. That is my information. I tried to be very quick so that everybody will have time for their questions. and I will let y'all take back over.
Alrighty, thank you so much, Candace, for presenting. Sorry. So again, thank you for presenting. Sorry. So I've been looking at the chat box, and we've had some questions, but it looks like most of them have been answered. But I want to go through them so we can talk about them as a group, because I know some folks might be like on a cell phone. So the first question, sorry, I'm trying to, let me pop it up so it's easier to read. So the first question we had was from Vicki Rose regarding, so it says, if a person has straight Medicaid, meaning the community Medicaid, does that mean they are more likely to qualify for the MLTC? And so I'll kind of I think Candace had answered that a little bit in the chat box. Candace, could you chat a little bit about that?
Sure. So community Medicaid is more the traditional type of Medicaid most people think about for impoverished individuals, women and children. So, and also if you have a disability, but that's an income only test, and there's an asset test for this type of Medicaid. So just because you qualify for community Medicaid doesn't mean you're automatically going to qualify for home and community-based Medicaid. You know, it's more than likely easier because you're going to be lower income. The chances that you have substantial assets would be lower, but you know, it's not a guarantee.
Thank you. And then the next question I saw was, Marissa, if you can tell us a little bit about this. What is the average amount of time an applicant will be on the wait list? And does all of the applicants have to go into QIT, or can only the amount that puts them over go in? And that is from Jill Preston. So Marissa, could you chat a little bit about the wait list, and then maybe Twyla about that QIT?
Sure. The wait list, we get asked so all the time about the average amount of time. There really is no average amount of time. The waiting list changes every single day, actually every hour that we put somebody on the waiting list. So like I was saying, it goes by the person's frailty. We may, if there's somebody who is really frail and we have funding that following month, they may get on the program that following month. We've seen people stay on the list for years and years, 5 and 6 years. So we really can't determine, and there is definitely no average amount of time somebody's on the list.
Hey, Yolanda.
Candace, you wanted to answer about the QIT?
I can let Twyla, but just about the wait list and timing. So how the wait list is structured is everybody has a rank and priority score. If you're calling in through the ADRC, you're going to be given a rank of 1 to 5, 5 being the highest priority. And that's based off your need, of course. So typically with my clients, what I see is less than 6 months on the wait list. And that's because we spend time talking about what their needs actually are versus how they think their needs are and what they're presenting. You know, a conversation I have every week is we live in the South and we were taught not to talk about what happens in our home. And this is not the time for that. We have to put all of that aside and give them the full picture, regardless of what it says about us, because, you know, Marissa doesn't know who we are. She doesn't know what happens in our home, and you have to be able to draw that picture for her.
Right, Candace is absolutely right. We do take into account the frailty of the caregiver as well. So if there is a caregiver who is providing, you know, helping the client, then, and that could be even in an assisted living facility, somebody who's helping with the paperwork or that person's affairs, they could be determined as a caregiver. And if they are in a crisis situation or in a bad situation where they're not really able to do that, then that will help the client's score on the waiting list as well.
I wanted to ask Jill Preston's another question. Maybe Twala, you could answer this. What happens if a person has no family to pay the family contribution and doesn't have enough income to pay the rest of the room and board, but they're appropriately placed for assisted living? Are they forced to go to skilled nursing?
Unfortunately, that's oftentimes what has to happen. And we go back and forth with families all the time because assisted living facility is where we'd like to go. Nobody ever wants to go to to a nursing home. But unfortunately, because the way our Medicaid system prefers institutionalization, we do have to. So if you have, and I have clients who are, single widows, their family is all gone and they only have $1,800 or $1,900 a month in income, they can't afford the room and board. And, either you ask the assisted living facility to not charge them, or you transition them to assisted living facility, or from the assisted living facility to a nursing home. And that's really a sad thing. And if you dislike it as much as me, you should really reach out to your legislators, because in other states, this does not happen. In other states, Medicaid will pay enough to have that person stay in assisted living. So I'm a big fan of calling your legislators. I did want to talk about the QIT question that I think Jill asked as well. Depending on where you are, nursing home, assisted living, or at home, depends on what money you put in your QIT. Also, as part of the Medicaid planning, sometimes I have my clients put all of their money in the QIT if they're in the assisted living facility, for the purposes of, in rare cases, raising up the amount of countable assets they can have. So you really should, the law says you have to put at least the minimum between what the income cap of $23.49 is and your income. If you put more in there, it's not always a bad thing, and in some cases it's a good thing.
Another question, and this, whoever can answer this, can you confirm that the amount of income attributable to aided attendance doesn't count towards Medicaid income eligibility?
Yeah, I can get that for you. So aid and attendance is not countable, but we need verification from the VA that what you're receiving is actually aid and attendance benefit, because DCF is going to make the assumption that if it's just VA and that's all it says, they're going to count all of it. So we needed that letter from the VA, which is extremely difficult to obtain. So sometimes I get my family started on that first, because you might wait a month or two before you get an answer from the VA. If the VA sends you regular contact about your income, you should definitely keep that. To add to Twyla's comment about talking to your legislature, just so everybody is aware how Medicaid works in Florida, in undermanaged care, it's a per capitated rate per person. So that means every individual is worth a certain dollar amount. They're paying the managed care companies roughly $5,000 a month per person, but the managed care company is then only paying that $1,250 out to the assisted living. So if that doesn't get you started, I don't know what will.
Yeah. So that managed care, then also, one of the things that you need to know about managed care organizations is our statutes have built in them a bonus paid to managed care organizations that transition a person from an institution into home and community-based services. Yeah. So you can get somebody eligible for Medicaid while they're in the nursing home, and then work with the managed care organization to transition that person into the assisted living facility like Tapestry. And that sometimes can be easier to go that direction than it can be being on the wait list and waiting to get on. So sometimes we have to have very frank conversations with family members about getting their parent into a nursing home, so that ultimately our goal is to get them in the assisted living.
And I've done that with several folks.
Does that also apply to hospitals? Recently, it sparked my thought process. We did have an individual transition from the hospital, and that they said the case manager was able to get the Medicaid. And, you know, I thought, great, fantastic, but I took it with a grain of salt because I know how the process can be. And indeed, they will be eligible for billing on November 1st.
And the way that works, because I've actually helped in a couple of cases to do that from the hospital, and it takes some pretty strong advocacy from the hospital discharge people as well as whoever is that patient's advocate. But if you explain through that wait list process that they're going to go to a nursing home if they don't get Medicaid waiver benefits, sometimes that shortens it because you're at imminent risk for institutionalization. The other part is if that person has already been on Medicaid long-term care, so they've been in the nursing home and then they go back to the hospital. The other way I've done it is once they're in the hospital, we don't want them to go back to the nursing home. So they're already on the wait list. They're already part of a managed care organization. And we say, well, let's send them to this assisted living facility.
Thank you. And so I think that finishes up our questions. I'll kind of just do a last, if there's anyone maybe who is on the telephone that was not able to chat in a question, if there's anyone who wants to unmute themselves to ask a question. All right, well, what we will do is, as I mentioned, we did record this, so if you missed any part of this, we'll be able to play it back for you guys. And I also, in that email, will include contact information for Candace, Twyla, and Marissa. And so I really thank everyone who participated, asked questions, as well as to our speakers. We appreciate everyone's time, and, you know, thank you guys for joining us today.
Thank you, Yolanda.
Yes,
Bye,
thank you
guys.
for
Have a
having
great
us.
evening.
Oh, hi, baby.
Hey!